Wonderful.
We've got still a couple more just on their way. And I think our waiting room is now empty. I think we're ready.
Wonderful. Thank you, Sharon. So good to be back, everyone. Hello, and welcome to our first training session of 2022. Happy New Year, everyone. I'm Susie Johnson with the New Mexico Alliance of Health Councils, and I'm here to welcome you to the Capacity Building Self-Assessment Workshop today. Don't stress, we are trying to get you prepared for what you'll be reporting in February. So I know you're working on your vaccine action plan, but we don't want to leave you hanging for when this comes around. So yes, we do record all these sessions. We have a lot of new hires coming on. I'm so excited about all of our new hires. Please get with me if you have any questions. And what I've been trying to do is, as I know of the new hires' email addresses, I'm sending them a link to all our past trainings. Keep in mind that this is ever changing and we develop as we figure out better ways to do things. But if you watch trainings such as the invoice and reporting, the stakeholder engagement, all those things, you may see small adjustments, but the main concepts have not changed. So once again, welcome. And I do want to ask that for attendance purposes, as you enter your name and organization that you're with, if you're a health council, please add your in your chat your position title, because what we're trying to do with the Alliance is update our contact lists. And we have a lot of new hires, like I said, so please remember to include your name, the agency that you're with, and if you're a health council, please include your title for your position. Even if we already know who you are, just put it in there anyway, just in case we don't have it. All right, and also remember to mute yourself if you are not speaking. And I believe that is all that I planned to say today. I will turn the rest of the welcome over to Anne so she can go over the agenda with us.
Thanks so much, Susie. Can you hear me?
Yes.
Okay. And I'm having a little trouble with my PowerPoint. Part of it is when I do a screen share, I have this drop down that hides the slideshow button on my PowerPoint. So if anybody has a secret, let me know. What we're going to do is cover a number of things today. We got a lot we're going to be covering, and I'm excited about this. We're going to be looking at going over self-assessment and capacity building, and Susan Wilger and I are going to be doing that. And then you're going to hear from Geraldine and Susie some council stories that are practical examples of how different councils have been working on building capacity in each of the in each of the 8 areas that we've identified for capacity building. Then we're going to have a break. We're going to have small group breakouts, and I want to thank the people that are facilitating a small group discussion, because I think this is going to be a very rich discussion where you talk about where you see your strengths with your health council's capacity, as well as where you see some areas you'd like to further grow. And then there also will be some discussion about how you'll be engaging others in sharing in the self-assessment. Then we'll have some reporting back. And I wanted to mention to you the reporting back on the 20th, when we talked about stakeholder engagement, was so rich. And I'm going to be summarizing that and sharing that. And part of what we want to be able to do as part of this self-assessment capacity building is gather as many stories as we can from you all, because there's a deep richness in the health councils, and we want to be able to have a lot of information and stories and examples about what different health councils are doing, so that as we move through 2022, if you have a particular area that you want to see what others are doing in that area, you've got a resource. So we're going to have a rich discussion in the small groups, reporting back, then we'll have a summary and a wrap, and that's pretty much it. So what are we doing about self-assessment, and what is that all about? So as we're looking at the self-assessment, there are 2 things that we wanted to talk about. One of them is the self-assessment itself, and the other is about the capacity building.
And
yes.
I'm sorry, it's Chris, but it may just be me. Is there any way for you to make the slide a little smaller? It's such huge type, I can't see the whole thing.
Thank you. Is that better?
Uh,
There you go.
there
Right.
you go.
Thank you, Chris. I appreciate it. Okay, together we can do this. So self-assessment is where you rate your own council based upon a group of generally accepted priorities for organizational development. And Susan Wilger and Sharon and I worked on this with the core team for quite some time. And basically what we've created is a group of 8 benchmark areas or 8 domains that really are focused on organizational development and health council work. And that you all will manage the process and identify who you want. We've developed this self-assessment using a Survey Monkey, and we'll be following up with you on how that's working and send you links and all that good stuff. And what we want you to do is to pull together a group of people that you think are really representative of both your council and the community, that really represent a diverse, equitable group of folks that can represent the Health Council. So that self-assessment is the first step, and it's not an intensive, academic sort of in-depth assessment or evaluation process. It is a taking your temperature, what things look like right now. And in that self-assessment, you're going to identify what you all see individually and collectively as your strengths and weaknesses. And then we're going to work together to build a capacity building process where you're going to identify one or more goals for your capacity building. And they're really the goals that you choose as a health council. And then we want to work to support you in developing strategies that will help you really build that. The idea is this is really, capacity building is like going to the gym for your organization. And we're all working different ways to build our organizational muscles. So that's really what we're looking at doing. And a couple of more things on self-assessment. Can you all read this? Okay,
Yes.
so it's going to begin with the dialogue. Thanks, Geraldine, where you talk with your health council folks that are going to participate in this, and you're going to use the self-assessment to identify areas that you want to further develop. It also provides both you as an individual health council and health councils collectively, and if somebody could mute, a basic foundation for capacity building. It provides you a baseline. I'm being muted. Can you hear me? Okay. So it offers insights to councils about how a representative group of members really see strengths, areas where you want to improve. And what we're going to be doing is we'll look and see, is there a lot of alignment and agreement about, what people are saying? Are there some trends? Are there some differences? All of that provides you with just some really rich information that you and we supporting you can use to really build your capacity. And it enables NMAHC and the staff to really better understand how you see yourselves as health councils. And it will help the network to better implement the vaccine equity plans and to address the requirements of HB 137. Because if, for example, issues of, let's say,
I can't find the volume.
Could you please mute? So then the last thing is, to have a baseline really allows all the health councils to have the same sort of period in time where you have a baseline. So that's really what we're focused on with self-assessment. And now what we would like to do is Susan and I want to walk through what this survey is about and how we develop these 8 domains. You all with me so far? Just do an emoji or a hand thumbs up.
Yes, and I'm going to make a tiny suggestion, but if it's not doable, that's okay. There should be a way where you could do slideshow, and that will get rid of, if it's okay with you, what is on the side and maybe make the center a little bit bigger if it doesn't mess you up in any way. If it does, don't worry, we can see.
Well, the problem is that I know where the slideshow thing is, but when I do a share screen, your share screen thing comes down and it covers up the slideshow.
Oh, okay, no worries, we're
But
good.
you know what I can do? If you're good with this, Susie, I will send this to you. And then as soon as you get it, why don't you just turn it into a slideshow? If you can make that work, that would be awesome. Because I know
You
I'm
can
not able to
also
do the-
slide the left-hand column over a little bit. It'll give you arrows with your cursor and just slide it over and minimize the left side as another option.
You are awesome.
That's awesome. That's perfect. Thanks, Matt.
Thank you, Matt. All right. Again, it's a group effort. So the Survey Monkey has about 52 questions. And we wanted it to really help you take your temperature without having so many questions that some of your volunteers would go, no, I can't do this. It should take you about 10 or 15 minutes. It's a Survey Monkey with a link. If by any chance you need any hard copy, we can certainly manage that. So the first couple of questions are demographic, and they're basically for us to know which health council, so that what we're going to do in the Survey Monkey is use their filter so that we can take a look at filtering each separate health council. Then here are the 8 areas, and equity is the first. It's really the cornerstone upon which our work rests, and the questions in the equity area cover information about, are you all committed to equity? Have you talked about it? How have you talked about it? Do you have an equity committee? Those sorts of things. And with equity, I know that the NMAHC design team is still working to define equity. There are lots of different definitions, and one of the definitions, we've defined it in the Survey Monkey using the Annie E. Casey definition of equity, which really focuses on creating the sort of landscape where everyone has comparable access and where we really are focused on all of the different dimensions of equity: racial, cultural, social, health, economic. Then the second area is stakeholder engagement. We had a training on that last month, the 20th. And the questions on stakeholder engagement are asking health councils about how you are involving all of the different groups in your community or communities that you serve, so that as we look at expanding and developing stakeholder engagement, it allows all of us to really involve more people in a way that strengthens membership, and it engages the community. And it provides also, one of the great things about stakeholder engagement is more hands sharing in the work. So it really helps to diversify and strengthen the base of volunteers that are involved. It also really strengthens the voices, so that when you're looking at making a difference, whether it's locally or around state policies, when you've got hundreds of voices that you bring to the table, people tend to sit up and they tend to listen. And so really engaging stakeholders. The other reason why stakeholder engagement is so important is when you're looking at community-based planning, really having stakeholders weigh in, not only into helping to shape your goals and priorities, but also to really help to develop greater understanding and support for the goals and priorities of your work. And that moves us into the next area, which is planning. And one of the things that happened with the House Bill 137 health planning councils is that health councils play an increasingly important role in the state in terms of really being in charge of local planning. And so part of what we want to be able to do is to provide health councils with supports for doing the kind of planning work, which it includes data. You're going to use data. You use stories, you use discussions, focus groups, all of that rich work that happens when you're looking at planning in such a way that really springs from the community and it's for the community. So all of these sort of build on each other. And the fourth one, we're looking at goals and priorities. So every health council has its own goals and priorities. And in preparing for this workshop, I looked at all the fact sheets on the NMAHC website, and it's wonderful to see the goals that are priorities for different health councils. And many of you have behavioral health or substance use disorder related goals, which makes sense given what we're dealing with in New Mexico. There are also goals that relate to youth. There are goals that relate to access to care. And so part of what we want to be able to do with the capacity building is to really see what your goals are, how you've developed them, and what else you need to really turn those goals into action, so that this fourth area in the self-assessment looks at how you're implementing your goals and priorities. And so I've covered this much, and then Susan and I spent a lot of time together on Zoom and in meetings and on the phone developing this and then updating it. And Susan is going to explain 5 through 8.
Hi, everybody. Thank you, Anne. I just wanted to add, just to let people know, Anne and I have been doing this work and working with community coalitions for many decades. And the 8 domains that you're seeing is really based on best practices and research. What makes a health council or any kind of community coalition function well, have an impact, and sustain itself over time? And so that's how these 8 domains came up with. Every one of you have capacity, otherwise you wouldn't be a recognized health council. But like we as individuals, we always want to improve what we're doing. And so I'll take domains 5 through 8. Number 5 is the outcomes and impact. What this domain is about is, so what? So what about your work? Are you making a difference? And so as health councils, you want to have some kind of way of demonstrating that you are making an impact. And that may be that you're using qualitative and quantitative data or community knowledge, not only for your planning, but also sharing it with community and others and being able to demonstrate that you make a difference. Domain number 6 is organizational system and processes. And this is how you operate as a health council. So in this domain, it's looking at things like, how do you carry out a meeting? Do you have shared facilitators? Do you have one leader? How often do you meet? Do you have bylaws or guidelines that really help guide your work in a fair and equitable manner, where it's documented and written, where everybody, has a voice? So those are things that we're looking for under systems and processes. The 7th domain is your communications and marketing. And this is pretty self-explanatory, but obviously, as we do our work, we really want other people to be able to know about what we do, so that you have visibility. The communications includes not only external communications, how you communicate within your tribal community or your county or with state or other stakeholders, but it's also with regards to internal communication. How do you, what is the messages? What are the methods that you use? Who are you targeting with your communication? Those types of things. And we've heard many really great examples at our last meeting about how people use, how health councils effectively communicate. And finally, domain number 8 are resources and funding. This is how, as we know, our resources contribute to what we're able to do. And so we're looking at not only funding resources, but what is your capacity for making sure that you're leveraging the resources that you have available to you in your tribes or in your counties? And are you using volunteers? So it's both the funding that you have coming in, and hopefully you're either targeting to have multiple funding sources, or you already do, but it's certainly getting that commitment by others to be able to contribute their time and their resources to your health council so that you're able to sustain and do all the wonderful things and do it bigger and better over time.
Awesome. Thank you so much, Susan. So the last part, I think there are just a few questions at the very end of the survey, which ask people to identify capacity building priorities. And then that could be used as grist for the mill for you all to settle down on one or two. And then also there's a question asking people, just what's important in terms of support. And we want this to be a process that provides an opportunity for the health council to engage in dialogue, to really look at, well, what are we doing well, and how have we developed, and then where do we want to continue to develop. And as we look at this, before we move forward, there are just a couple of things that I want to mention about the framework for self-assessment. We already talked about how, I guess, Susan, you and I have about 75 years combined, but we won't necessarily use that to say how old we are. But we wanted to really develop a process that's hybrid, that uses organizational development and health council and DOH and then HB 137 pieces. And so that's what we put together. And so the work that we're doing with the self-assessment, it integrates nonprofit organizational development standards, health councils, and DOH. And it's informed by research, consulting around self-assessment and capacity building. And it also incorporates CBPR, the community-based participatory research. And then we wanted to make sure that it's practical and addresses issues that are important to health councils. So you'll see questions about the health equity work that you're doing. You'll see questions about vaccine equity and about what you're doing with data-driven planning and things that relate to HB 137. So we want it to be very practical. The theoretical framework, I've already talked about this. And our goal, to really boil everything down to its essence, our goal is to start with a short, practical survey. We don't want the kind of survey where people will go, okay, I'll come back to this. And then you know what happens when we start a survey, we say we'll come back to it. So we want to be short and practical, where people that you choose reflect on your work in these 8 areas. And then we're going to share a summary of this with each of the health councils, so that each health council has a chance to get some feedback from us. And I'm working on this, and my consulting associate, Kim Gabaldon. And Kim, if you are here, please wave. I think part of what we want to do is we want to follow up, and we're going to be working with both Susie and Geraldine to follow up with you all, to share a summary, and then to really look at discussing what your priorities are for capacity building and how we can support you in that. The feedback that we're going to get as we look at the entire group of surveys will also help us to develop the priorities for training in some of these capacity building areas later in the spring. And so I am really thrilled right now to introduce you to some stories that Geraldine and Susie are going to share. And I want to kick it off with a really quick note from a conversation that Susie and I had this morning. Susie said, I want us to have examples of where organizations are throughout the continuum, because we're all growing and developing. And part of what we want to be able to do is to identify as many stories as we can about how we're all working to build capacity. And so our next section is going to be focused on, I'd like for Geraldine, if you're comfortable with this, for you to kick us off and spend about 8 minutes sharing your stories. You and Susie both have so many rich stories to share. And then if you could share yours and Susie could share hers, and then we can take some questions and comments. Geraldine, you good to go?
Yes, I'm good to go, and I will share my screen right now.
Awesome, thank you.
Okay, can you all see the screen? Okay, let's see. Oops, sorry about that. Trying to hit the present button. Okay, so we're going to be sharing stories about tribal health councils and some of the work that's happening and things that we've been hearing, and also things that have been reported in some of the monthly reports that have been submitted. So I'll be focusing on some of the tribal health councils that I'm working with. And as Anne and Susan had shared earlier, some of some of the concepts that we're working with around equity, stakeholder engagement, planning, and aligning goals and priorities. I'll share some examples. So first, for equity, we see that some of our tribal health councils are really trying to diversify their health equity committee or their health council. So part of that effort is an example with Coach T. Pueblo and Santo Domingo Pueblo have recently established their health councils and getting that started, but they've actually planned and also included youth to be part of their committees, which is great because I think that without community change, collective voice should definitely be there at all times. So, definitely including the youth. And I think if I can remember, they had reported that maybe their youngest member of their health council was 16 years old. So they're definitely getting a lot of the youth representation in there. And it was really great. Iris from Santo Domingo had shared that she had asked their youth what do you see happening? What are your goals for this committee, and where do you see our Pueblo being, years from now? So definitely, you definitely get a different perspective, and that's definitely what Iris and Anthony Yeppa, they had shared. So it's great to see the youth representation, and also not only are they including the youth, but they're actually including elder. So they have, members either from the senior center joining, being part of the health equity committees, and providing their insights and feedback into, the things that they are planning and discussing. And then also moving in with Canyoncito Band of Navajos, a lot of great work has been happening there, and they are definitely planning to diversify their health equity committee. Right now, currently it's their health board that they serve from their health center. But again, they're planning to expand beyond that, which is great. So, and going on to stakeholder engagement, we do have county to tribal engagement. So for this, I was really happy to see that a lot of our county health councils are reaching out and wanting to engage with some of our tribal health councils and tribal communities. So I have listed here, Arriba has been doing it and has been engaging with Santa Clara, and also San Ildefonso. So those are some of the health councils that we're working with. And they're working on a housing project and some housing funding that they recently received. So Lauren is working hard to try and incorporate a lot of those tribal members and trying to see, what they can do to kind of expand the funding. And then also Sandoval County recently expressed interest in engaging with Santo Domingo and Cochiti. So it's great. And also Luna County is we're working together to get them to connect with Fort Sill Apaches. So not only, is the collaboration happening, just amongst the community and the tribal programs, but you're now seeing the transition from county to tribal, which is really great. So I'm excited about that, and it's really great having to make those connections. And then also, a part of our DOH partnership. I mean, that's one of our biggest stakeholders, and it's so great. Recently reported, ACMA has been working with DOH to do a lot of youth vaccinations, which is great, and working with their public safety department. So it's so great that they reported that in November, and the youth vaccinations are happening. And then moving into planning, a lot of our Pueblos and tribal health councils participate in the Indian Health Services, so weekly calls, and a lot of those calls in planning and prepping a lot for the things happening COVID related in communities. They're discussing COVID cases, vaccination rates, vaccine clinics that are coming up in the area, or any in the tribal communities, and also challenges with the Pueblos and some of the local clinics. Maybe if maybe someone had not received vaccines, or there was not enough vaccines, or if there's a target population that they need to really get to, or a certain Pueblo. So definitely those planning calls are happening, and it's great to see our tribal health councils being part of that. And then also aligning goals and priorities. In the new year now, we're seeing that there's going to be new tribal leadership. So I think this is important because with the new leadership coming in, helping them understand the health council work that's happening and the goals and priorities that they have for their community. So getting them on board to be able to support future work that's going to be happening. And then also tribal programs, making sure everyone is getting a seat at the table. A lot of tribal health councils are working to get more people at the table, like including elders, senior centers, behavioral health, CHRs, transportation, trying to incorporate more of the cultural aspects, like especially like the language, and then Head Start and natural resources. So tribal health councils are working to try and align efforts with their tribal programs and tribal leadership as well. And then, under that, tribal leadership has set a lot of precautionary measures. Protocols are changing. Pueblos are closed, and a lot of large gatherings are not allowed. So I think part of this too is things that health councils have been reporting and that they have to follow under tribal leadership. So as mentioned before, tribal health councils have to talk with tribal leaders about projects that are happening, make sure that they get their support and that they can sign off on things that they want to do or plan for the community. So most definitely, I think in part of capacity building, tribal leadership is so important, and the existing, but also new tribal governors coming in to the community. And then just my last three here, outcomes and impacts, just some examples with the data dashboards that have been recently released by NMCDC. So all of our health councils, tribal health councils have been reviewing that. And definitely the biggest thing that comes out, the concern with data sovereignty, access and ownership. So we've been using Acoma Pueblo as a pilot right now, and they're actually reviewing the impacts of maybe, what it would look like to have their dashboard public versus a private to the community, and whether they want to just keep that as an internal use. And, we're just there to listen and support their decisions because we want to respect what they want to do with the data. And also, they're just in reviewing process right now with their health board. It's not just with the health council, but this includes their health board, health director, their tribal counselor, their tribal leader. So definitely a lot of planning and reviewing going into the data dashboards. And also they're looking at, how can this information be interpreted from community? Is it easily translated? And can community members understand what the data represents, what it's saying, and really looking into it. So it's really great. That's just one example I can provide, but we definitely do have tribal health councils reviewing theirs and talking over with their health councils and tribal leadership. And then going into communications and marketing, we definitely have all our tribal health councils who are advertising for vaccine outreach and testing and quarantine. So just one of the examples here is San Ildefonso Pueblo. They recently launched their website. As you guys know, they had mentioned that in a previous training, and then also the podcast that they have coming out soon. So we're excited, Troy, whenever you get that going, we'd love to post that and share that. And then Nambe Pueblo, they reported they've been, just doing a lot of advertisement for vaccine clinics and for a lot of the younger ages. So a lot of this is happening through the Nixle alert system, their community marquee, the Facebook page that they have, and they do a lot of door-to-door interaction and a lot of phone calls. So those are just some examples. And again, mass testing is happening in a lot of the Pueblos. From my understanding, they've been happening weekly. So that's really great, a lot of mass testing. And they do a lot of follow-up. So you can tell there's a lot of door-to-door and phone call interaction. And it's so great to see, what they're doing. A lot of that is more personal connection that I'm seeing. And then what's really great is Santo Domingo actually didn't report this, but they mentioned to me in a previous conversation that they actually have a really strict quarantine process. And they actually have 15 mobile homes that they have set aside in their community for those who have tested positive. And if they don't have anywhere else to go, they have mobile homes available for community, which is just awesome. And it's really great. So they have 15, and it was really great to hear about the process and how they got that, and also, how they're helping out the community. And then last, resources and funding. Definitely the change in staffing is happening now with tribal health councils getting new staff members hired on for this particular project. And then also, those who have hired have been doing a lot of vaccine outreach, promotion, and education. And again, that's by door to door and a lot of phone calls. And I just want to share that Canyon Sito Band of Navajos has been working on a walking trail, which is really great because their emphasis has been on mental health. And they actually got the walking trail up and running. And I mean, definitely during quarantine and COVID, that the walking trail has been so incredibly helpful for a lot of their community members who have been feeling so isolated in their homes. So that's really great. And then the funding opportunity, so 2 of our Pueblos got a funding opportunity to be part of a community health forum and engaging with community through surveys and health forums. So those are just some of the stories, but not all. And I wish I could share all of the stories because all of our tribal health councils are doing such wonderful work.
Oh, this is so awesome, Geraldine. The work that's been happening with tribal health councils is so exciting. And I think over the coming months, we will have a chance to share all of these stories. And as we're, listening to one another, if you've got a story, post it, in chat, send it to, Madeline, Geraldine, Susie. We want to be able to just capture these stories. And as we move forward, because there's such rich work happening. And Susie is going to do a dive into some more of that rich work.
Thank you, Anne. Thank you, Geraldine. Yeah, that was a really hard act to follow. Mine is not, I don't even have a presentation. So Geraldine, that was beautiful. It is a thing of beauty. I really think visuals are so helpful. I don't know about y'all, but I like to see. And so she laid that out just really, really well. Well done. And yes, this is a perfect example of how so many of our health councils, tribal and non-tribal, you're already doing so much of the work. We're just trying to build on it. And like Susan said, there isn't anyone that doesn't have capacity. Everyone has capacity on some level. We're just trying to make it better. So yeah, it's just going to be me talking. So I don't have a presentation, but yeah, I did want to reiterate that I gather what I'm saying, and I assume the same thing for Geraldine, in conversations that we have, whether they be via email or phone, but also on your reports. Yay, reports, because this is where I'd love to see less not applicable in the challenges part though, because we need you to be honest with us about any challenges that you're having. Otherwise, we won't really know where to gear these trainings towards. So thank you for sharing all your successes and your challenges. And this is where I pull some of my information from. So just to remind everyone that it's very likely that I won't call you ahead of time to ask permission to share these. I found them on the report, and therefore we're going to share them with everybody so that we can all know kind of what we're doing well at and what we can use a little bit more development on. And so just keep in mind as I reflect on some of these examples, like Geraldine, there's just no time to include everybody. So I've only selected about 9 or so of the non-tribal health councils to talk about some of these capacities and to show how some of them are fully developed, but some of them are just being developed. And I'm excited about the ones that are being developed because I just really like to learn. And I just think it's kind of interesting how we can go from one point to, by the end of this project, you will be able to say, oh, I remember in a training, they mentioned how we were thinking about doing this thing. And we were kind of toying with the idea, trying to develop it. And then you'll see yourself, fast forward to the end of the project and you will be more developed in that area. So, okay, I'm gonna move it right along and talk about the highlights. So in terms of equity, Anne mentioned something very interesting. She said, have you even talked about it? Well, there is somebody who has talked about it, and I would like to highlight Colfax County. We all had our struggles. I personally had my struggles when we started this project, just trying to learn everything, trying to understand where everyone was, what it all entailed. And Colfax is no different. They also had their own challenges, but despite these challenges, Colfax County in October started a conversation. Well, what does vaccine equity even mean? Who needs to be at the table? Who from our community needs to be involved in these conversations? And it's all about representation. And they even did that, as many of you did, not only with your health equity committees, but also with the people that you hired. So bravo. All right, so another example of equity, but in addition to equity, stakeholder engagement and resource and funding would be Torrance County. In collaboration with the school, stakeholder engagement, Torrance County identified a population that is in need, but was being overlooked. And these were individuals that need help paying for food and for the fuel that it takes to travel to support their family members that are in the hospital with COVID. And it was the fuel assistance portion that really proved to be the most challenging. So some of Torrance Health Council members created their own personal donation fund. they teamed up with a local gas station, more stakeholder engagement, and that local gas station matched their donation. So with what they gathered, they were able to purchase gas cards and distribute them to the families most in need. And they found out who those families were, again, by working with the school. So that's about equity, looking for those populations that everyone else is not paying attention to, collaborating with other agencies, and of course, just thinking creatively of how to get these resources and funding opportunities. So way to go, Torrance. All right, so a little bit more on resources and stakeholder engagement. Valencia County, in order to assist building out their resource directory, they trained volunteers to vet calls for their 100% community work, and they started making calls to the community organizations. So again, we're just, sharing resources and collaborating with other agencies. Another example of stakeholder engagement is Hidalgo County's coordinator, Margaret. She mentioned this in one of our last training sessions, that it's something so simple, but I think that it doesn't get enough attention. Geraldine commented about these personal relationships. I think that that's where it is, because Margaret just makes it a point when she's out and about in the community, doesn't matter what she's doing, if she sees someone that is involved in this work, she makes it a point to approach that person, because you don't know, they could be a potential stakeholder, a potential community partner. And so just a simple greeting and remembering their name and remembering something about them and what they do for their work. She's making that personal connection. And then she's asking how it's going. How is their department going? How is their program going? So that as time goes on, when she has to make that call to ask for them to be maybe a potential health council member or a health equity committee member or collaborate down the road, those calls are easier because she already made that connection. All right, so next I want to talk about planning. So Anne mentioned that it's one of the main parts of the HB 137. We use data so that we can kind of know where to go next. And the reason that the work of the Health Council is so valuable is that people that make up the Health Council, you live in the communities, you know the context and the particular nuances of the county where you live. And other counties may be doing something, but maybe it doesn't work for you. Oof, my connection is unstable. I'm going to turn off my video. I'm so sorry, but I don't want to interrupt what I'm saying. All right, so so back to this. So let's say you live in a county and what other counties are doing doesn't particularly work for you. Well, I have a perfect example of planning, and that would go to Roosevelt County. They needed to strategize and plan accordingly. So their first planning action was to create a survey so that they can see why their county isn't getting the vaccine. This is going to allow them to assess where to go from there. So that's an excellent example of a planning action. Another example of planning would be Socorro. They attended the Presbyterian Medical Services Regional Guidance Meeting, and this was to discuss plans for COVID vaccinations and testing. And they also wanted to get public opinion of the COVID boosters and then find their next steps for their health councils. You see, planning, next steps, I love it. All right, a little bit more on planning and organizational processes. In October, Sandoval County convened a working group to move their process forward and to establish priorities until they had a project coordinator in place. In November, they encountered a number of bureaucratic obstacles with the hiring process, but they overcame these obstacles, which prevented them from having to wait months to get someone on board. Soon afterward, they had a new project coordinator to take the lead in the work, and now they have solid experience and a foundation about their hiring processes as a health council. So that's wonderful. Excellent example of organizational processes and planning. A little bit more on organizational processes would go to Bernalillo County. Let's just listen to their mission. To improve health equity and a quality of life in Albuquerque and Bernalillo County through coalition building, health assessment and planning, and supporting community action to promote, advocate for, and achieve health equity for all Bernalillo County inhabitants and communities. That's an excellent, that's their mission. That's really good example of organizational processes. In addition to that, they are actively recruiting new board members to their health council. All right, and so last but not least, and again, if you weren't mentioned, it's just because it was a time constraint on my part, but I would like to highlight goals and priorities. Keep in mind, public health issues are of course our goal and our priority, right? But then there's also goals and priorities for the project and where you find yourself in this process. So Luna County, based on where they were at in this project, After October's reporting period, they realized, oh, our priority needs to be getting a health equity committee established. So they created the priority, and then their goal was to start by identifying possible members for the committee in November. This might sound familiar to many of you. They did that, and by December they were established, and they've met twice since that date. So I'm just super proud to highlight all these stories. Again, my favorite part of the job, and I hope that that was helpful to everyone. Thank you so much for sharing.
Well, that's terrific, Susie. Yes, I mean, it's just so helpful to hear all these examples, and we're running a little bit ahead of schedule. So because of that, I'd like for us to take just a minute and look around and see. I mean, there's 73 people representing different health councils, and you all collectively represent this kaleidoscope of all of this incredible work. And so I want to thank you all. Please, as we move toward a break, I would like for you to just add anything you can to the chat. You know, your example. We're going to be continuing to gather these stories from these trainings, from the transformation team meetings, the discussions, and then the self-assessment. One or two really quick things, and then we will go on a break. As we look at the self-assessment process, let me see if I've got this right here. Thank you for putting up with my tech non-savviness. So we have the initial training, that's today, the 3rd. And then we're going to be following up, sending you some information with additional materials that summarize what we've talked about today. I'll have a summary not only of the 20th, but we'll have a summary of our small group discussions from today. We will also have a description about the survey itself, how it is broken down into the 8 different areas, and the process for engaging people in your health council and community. So that after we send that information, Susie and Geraldine will be following up with you all, and Kim Gabaldon, my colleague, will as well. So you'll have about a month, 3 to 4 weeks, to get the links out. Some of you may want to have 5 or 6 people that you target. Others may want to have a dozen. What you want to do, and start thinking about this, in our small groups we'll be talking about this, you want to get a group of people that you see as really understanding what the Health Council's been doing, that are really diverse, that represent the Health Council and the community, and they will be completing the Survey Monkey. And then after that's done, in early February, we'll start sending you summaries, and we'll be looking at the analysis and then having a follow-up meeting. Would like to have a follow-up meeting and be available to you as you need. And then we'll be sending you the capacity building. We'll have a form that you use for the outlining of your capacity building goal, primary goal, or goals and strategies. And then we'll have some ongoing training in TA. So that's the process that we're using. And the Survey Monkey survey is a pretty simple one. It takes about 10 to 15 minutes to complete. It is, it uses a Likert scale. And so there are questions in each of these 8 areas that Susan and I have outlined that ask people to rate and rank from not well developed to very well developed. And then we ask for the people that are completing the surveys to identify what they see as the Health Council's strengths and weaknesses in each of these 8 areas. So you're going to have, 4 to 6 Likert scale questions, and then each section ends with, what do you see as the strengths and weaknesses? And so then Kim and I will be pulling out those strengths and weaknesses in a word study to take a look and see where there are agreements within health councils and then across the network as a whole. So final comments, questions before we take a break?
And would you mind just telling people what a Likert scale is? I know it's a very simplistic thing, but thanks, Ann. It's Kim.
You have just heard from my colleague, Kim Gabaldon. Thank you, Kim. A Likert scale is basically asking you for your level of agreement to a particular statement. And so there are basically 5 levels. The middle is neutral. And then you've got 2 levels where you strongly agree, or you think it's strongly developed, and then where it's not. Chris.
Just a quick question, Ann. Did I understand correctly? So when are you actually sending out the capacity assessment for us to do?
Great question. We will be sending that out by no later than early next week, and you'll have 3 to 4 weeks to complete it. So you may want to start thinking, and when we break up into small groups, you'll have a chance to really talk about, well, who are you going to ask to complete this? And you'll have a chance to it's really simple. You'll just send your link, and we're going to ask each health council to invite a representative sample of people to complete this that also includes your DOH equity rep like Chris, and your DOH, promotion specialists. Like I saw that Jackie Muncie's on the call here. So that what we want to do is to have a nice collaborative representative sample. Any final comments, questions? And I couldn't read everything from Anthony, but Anthony, I'll take a look at this. Let's get back together at 2 o'clock. Thank you so much. Welcome back. Happy New Year. And in a minute, Madeline is going to work her magic. Welcome back. We're going to divide up into small groups now. Madeline, as I said a minute ago, is going to work her magic. What Madeline's going to do is she's going to put in the chat each of the small groups, right, Madeline? And then if you're leading a small group, just click on that and it will be your link and your Jamboard with the questions. And then Madeline's going to just work her magic again and send us all off into our rooms.
Yes, you should see the links to the Jamboards here in the chat now. And in just a minute, I'll open up the breakout room. So then you'll be able to see which room you should go to. And you can click on the link that corresponds with that in the chat. All right, let me open up the rooms here. And Anne, how long would you like the breakout rooms open for? I just don't have the agenda open here right quick, but I want to make sure I don't have them close early.
Sorry, that time frame is from 2 until 2:30. So you may want to start bringing us back in 27 minutes.
Okay, perfect. That sounds good. All right, they are opening up now. Hi, Troy. We just went into breakout rooms. Do you want me to add you to one? They just started maybe like a couple seconds ago.
Yeah, I'm in there from on another thing, but because our internet is messing up. So if you want to send me back to 6, I'll disconnect with the other one.
Perfect. Okay, sounds good.
Did you assign us a breakout room?
Yeah, you should have had a little pop-up come up on your screen. It looks like yours is room 4. Here, let me
Oh,
try.
I didn't. Okay. All right.
Do you see it now?
Yeah, I was trying to exit out of small screen and it took me there immediately. And just in the past, we chose. So yeah, I need to be
Okay.
redirected back.
Okay, let me see if I can get the little thing to pop up again. Here.
Okay. Thank you.
Yes, I'm just gonna try assigning you to room 1 instead, since it will give you a new pop-up then, I think. Did you see it? Okay. Hello, Christopher.
Hey there, are we in breakout rooms?
Yes, we are in breakout rooms. We just started pretty recently though. Do you have one assigned to you already? Otherwise, I can just add you to one of them here.
I don't think I have one assigned, but I'm just driving today, so I can't really participate as much.
Gotcha, no worries. I think people are just talking about sort of like capacity, strengths and weaknesses in their health council, sort of. So I'll just add you.
Around stakeholder engagement though, right?
Around stakeholder engagement and also around other things. We're going to be doing capacity self-assessments coming up here in January and February. So it kind of covers like the full scope of health council work, from like equity to like goals and planning, to membership and hiring and staffing and stuff like that. So kind of across a bunch of different domains, as we're kind of talking about a bunch of stuff today.
Okay, cool. I caught the first half, but then we went to break. And I was like, oh, okay. But I was in the middle of getting ready too. So just like, oh, it's a busy day.
Yes. Oh my gosh. Yeah. I will add you to room 5 here.
Okay,
and do you
cool.
see the link to the Jamboard in the chat? I can send you that as well.
I think so. Let me see.
Okay.
No, I don't have it in the chat. Just send it that again. Should work.
Okay. Here is the Jamboard for room 5.
Awesome. Thank you, Madeline.
Yes. Hello. If you would like me to, we're just in breakout rooms right now. So if you'd like me to help you get into a breakout room, just let me know and I can get you a link for that. Otherwise, I think that we'll be back in about like 15, 20 more minutes from the breakout rooms. Hi, Stephanie.
Hi, sorry, I lost service and I had to jump back on.
No worries. Do you remember which room you were in?
No.
You don't. Okay, let me see here. I think I should be able to find it maybe by checking how many people are in each room.
Okay.
It looks like maybe room 8. Do you remember? Maybe I think Jamie is the host of that. I don't see Jamie in here. Well, that's interesting. I'll go ahead and add you to room 8. It looks like that one is the lowest on participants.
Okay, thank
Oh,
you.
I see Jamie lost internet and lost her group as well. I'll just pop into that room quickly as well.
Okay.
Did you have Jamie as your host? Or your like facilitator?
I think it.
Okay, perfect. Yeah, so I'm gonna put you into room 8 here, and I'm just gonna pop in there as well. Jackie.
Hi, I am so sorry. My internet went down and then I got busy having to do other things. So I guess they've split out in groups.
Yes, we're about to come back. They should be back in the next like 4 or 5 minutes here from breakout rooms.
Are the groups recorded as well or no?
I wish they were, but we don't have a way to do that, unfortunately. I think you could only record like one group at a time, and then there can't be anybody in the main room. So it's kind of, yeah. So unfortunately not.
But these are recorded and put on the Google Drive, right?
Yes, recorded and put on the Google Drive. And I think that we're going to summarize these breakout rooms since we want to kind of use this discussion to guide the capacity assessment. So I think that we'll send out sort of summaries from like the Jamboards that people are doing in the next week or two here.
Okay, good. Yeah, because I was going to stay on, but then I got kicked off. Our internet went down, and then I got confusing up at the front, so I ended up having to work up there. And so, but I'll just wait till they come back. I don't think I need to get in a group. I'll just wait. I was just going to listen in this last 30 minutes.
Perfect. Okay, that sounds good. Yeah,
okay,
internet has been pretty messy everywhere, so I understand. I understand your concerns.
Yeah, it's craziness.
Yeah. Okay, we'll see you soon. Hi, Jessica. Jessica, can you hear me okay?
Yeah, sorry, I thought it kicked me out.
Oh, gotcha. Yes. It may have. I think it maybe sent you back to the main room. I don't know if you have the ability to rejoin, or I can also put you back into a room as well.
Yeah, I think I'm in there now. In the other one.
You have like a pop-up to go back to the room.
Oh, I guess it didn't. Yeah, I'll have to be back in the other one, into the other room.
Okay, do you remember which room you were in? Do you have your Jamboard up with like the room number on there by chance?
It was 7.
7? Okay, perfect. I will put you back into room 7.
Thank you.
Yes. It also looks like the rooms are going to close in 24 seconds. So if you want to just hold off, then you could do that too.
Are we done? Oh.
Welcome back. Hey, Evangeline, I just saw you.
You're just kind of stuck.
I can't wait to hear from each of these groups. Roberto.
Hey, Anne.
Hey,
Am I starting?
Great to see you.
Good to see you too.
Yeah, I can't wait to hear the feedback from these groups.
Yeah, thank you for putting this together.
Oh, you're welcome. Thank you for leading a small group. So while we're waiting, Roberto is the health equity person for Public Health Department and has been doing amazing work around the vaccine. So, Madeline, are we all pretty well back in?
I think so, yes. It looks like almost everybody is, I think everybody is back from the rooms now. They've all closed up.
Awesome. Okay, so let's rock and roll. Let's just start with group number 1 and go through the 8. And if each of you could spend just a few minutes with some highlights about what were some of the main themes that you talked about in terms of where you see strengths and weaknesses and how you're going to be involving a representative group to complete the survey. Group number 1.
I believe that's Sharon.
Oh, she's having technical difficulties. I'm not sure if someone can speak on her behalf.
Okay. Anybody else from Sharon's group?
Well, I was from Sharon's group, but there were a lot of different things that we talked about. Chris, you know these workings better than I do. I mean, one of the things we talked about in terms of strengths is like, so I'm from Sandoval Council, right? So I've been with the council for lots of years. We had lots of strengths on certain things around planning and goal setting and all that other thing, but we've never had this kind of resource, you know, to support our visioning. And we also have some new folks who are still getting oriented and kind of feeling their way around. So what we were strong in before, you know, not that we can't get there, but it may require getting there in different ways, I guess is where I'm going.
That's very interesting. And actually, we're not going to be returning to the way things were when there was a different level of funding. It's really recapitulating this and moving it forward,
right?
Because it's also a very different time.
Right.
Great.
Oh,
great
yeah.
comment.
Everything's different.
Everything, yeah.
Everything's different. Yeah.
Wonderful. Other comments from group number 1? Group number 1. How about then group number 2?
Hey, Ann. So I facilitated it so I could share a bit. So I definitely think that in our group, the strengths that definitely stood out were stakeholder engagement, and then some saying that marketing and communication has been working really well with them as far as relaying information to community, but also all the other stakeholders that they're engaged with, and planning and implementing goals and priorities. So I think when Health Council said that they stick to it a little too well, so learning to be flexible is definitely something that they're working on. And also funding has been one of the greatest strengths for one of our health councils, and supporting the work happening through contracts and grants has been working out well for them. And then one of our tribal communities mentioned that tracking outcomes and impacts has been one of their strengths, especially during COVID, and tracking vaccinations, COVID cases, and other things related to that. And also, as far as building capacity, we did see that some want to work on marketing again, social media, improving that, and learning to be more active instead of just kind of posting here and there, but also actually being active and trying to connect with your viewers. And then also trying to build a network of non-health providers. So we're seeing that a lot of our health councils, that's their primary network, but building outside of that is something that they want to work on this year. And then also, we talked about a thing about how health councils and their employers employers don't see the value of health councils because some can't take time out from work to participate in health council meetings, trainings, things related to health council projects that are happening. So I think part of that, we mentioned it was an equity issue. Employers don't see the value of health councils. So, you know, some can't make it to certain meetings, and that causes conflict, you know, in the capacity for the health council. So those are some of the things that definitely stood out in our group.
Okay, that's a lot. And I just silenced because I was just typing along, making lots of noise. How about group number 3?
Group number 3, their greatest strengths seem to kind of be on the 1, 2, 3, 4, and 5, mainly 1, 2, and 4. Los Alamos County says seems like they've got implementing goals down set really strong. They have lots of plans. They really want to do it right the first time. That's a really great one. Otero County recently updated their mission statement to include equity explicitly. so that's really great. They kind of saw that they both have a diverse group, but at the same time, in the diversity, they're also able to see who is missing from the table. So that gave them an opportunity for them to see on that weakness. One thing, Guadalupe County has also included a little diversity with the age, implementing and bringing in the youth voice into their health coalition.
Awesome. There's been a good bit mentioned about engaging youth more actively today, which is exciting. Group number 4.
That was the group I was in, and Ann was also there, and we had several other people, including Alicia Westmacott, who it's her very first day attending. So welcome, Alicia. And on the strengths, it was interesting because each of the health councils who were in the group had a different strength, at least their initial perceptions. So one was around equity, and another was around planning, another one was communication and marketing, and another one stakeholder engagement. So with strengths, they were at different places, which was interesting. But then when we moved on to question number 2, where would they most like to grow in capacity? Stakeholder engagement did come up a lot. So even if they felt they were somewhat good, like Cheryl was saying, I think the more that you start engaging people, you recognize the gaps. So people were really identifying certain groups that aren't currently involved or engaged that they would like to engage. Another area that came up in terms of capacity building was equity, and then another one was around communication and marketing. And then in terms of completing the assessment, nobody felt that that was going to be too much of a challenge. And yes, you can choose over 7 people if you'd like. That's not going to be an issue. So if you feel that you'd really like the input from a dozen people, that would be fine. So there wasn't any concerns there. And then learning from the assessment, I think really what it was around, they really invite the opportunity to see where their strengths are, but also those areas among the 8 domains where they also need to work on and continue to grow. And they're really appreciative of having the resources and the support to help them do that. So anything I left out from group 4?
Yeah, that was a very far-reaching discussion. Thanks. Susan, how about group number 5?
Hi, I'm Maureen, and I was part of group number 5. Victoria was our facilitator, and she asked me I took notes, so I'm going to just share with y'all what we discussed. So everybody represented felt for the greatest strengths. They mentioned the stakeholder engagement and equity. It seemed like everybody felt that they were doing okay with those strengths. And also it sounded like from what everybody shared that their goal, like identifying, implementing goals and priorities was going well also. And then for question number 2, where would you most like to grow as a council, how to build capacity and why? So hearing from and connecting with different sectors would be really helpful. So increasing like the voice of the community, and maybe the community doesn't know about or utilize or take advantage of the Health Council, would just like to see more community feedback, working on establishing more partnership networking and meaningful participation. So, some people shared, feeling like our Health Council is an information hub and would like to see it grow back into more of an action oriented, group. And that's hard. Recognizing that's been hard with COVID, and that's been difficult too, because there was the period of time where there was no funding or minimal funding. So feeling now like there's a hope that we could grow back into some more action oriented items. One group shared they're working on establishing community schools and talking with their local school districts, and that wouldn't be just focused on youth needs, but on whole community needs and individuals and families and everything. Let's see, participation can be an equity issue. So this kind of went back to when we were talking about equity on our first slide, wanting to reach out and get input from community members who don't regularly get asked for their input or their opinion. And then that was a lot of our growth and how to build capacity. On question 3, nobody was too concerned about completing the Survey Monkey. They all felt that they would have, you know, ample opportunity to get that completed and to have at least 5 to 7 people who could answer that in depth. And then what we got, as far as we got on the self-assessment, we were kind of wrapping up. One person just shared that they hope to learn what the newer members of the Health Council team want to learn about or need to know in order to be, you know, effective, engaged partners.
That is such a rich discussion. Thank you very much. All right, so number 6.
That would be me, and anybody from group 6 that wants to share, please unmute and interrupt me. But starting with question 3 and 4, all of the members said, like, yes, we can do this. It seems as a doable task. And more importantly, that they found that the exercise would be helpful to think about the roles of health councils in the community and the areas in which they can improve. So the exercise is important to them as well. In terms of the areas where they feel the most strength lies are in terms of planning, implementation, and communication, which it was interesting in terms of like the profile or the roles that health councils are to play in the communities. And in terms of areas of growth, I just mentioned a couple of things that hasn't come out. One is the stakeholder engagement, and I think actually that has been mentioned by other groups. However, they define stakeholders as those more like at the organizational level and ensuring that organizations can remain active and engage with the work. But also community engagement came up, and the difference between stakeholders and community engagement for the group was, well, members of the community and interacting with members of the community, not at the organizational level. And particularly the fact that with COVID-19, we have moved into this virtual world where community engagement, it's not done through our typical approaches of door-to-door canvassing or you know, actual human contact, as opposed to you know, our virtual contact now. So those 2 areas are areas of growth, and a couple of others that we will see in that Jamboards too as well.
Could you say more about moving into a spiritual area? That sounds fascinating.
I meant like virtual area.
Oh, virtual. Oh, okay.
Yeah. So COVID-19 has moved us into a virtual world where we are not able to do community engagement as we are used to. So, you know, learning how to do that in that sense.
That's going to be really interesting to get stories about that. We got some great stories, I know, from San Ildefonso, and it seems like a number of the groups have been talking about different methods to try to engage people on social media platforms and virtually. Interesting. Thank you so much. So group number 7.
Susie here. I'm going to leave my camera off because my internet is acting funny. So yes, we heard that the strengths lied for some in their organizational system and processes because they'd have been around for a long time. Some had a full understanding about equity because they had been doing that work for a while. Others felt that their strength was in equity as well. They excelled in the diversity of the membership in terms of age. Also, we had a strength of stakeholder engagement in terms of proven work that shows that they have excelled at getting cooperation from different entities in the county. And also just doing, someone else said, just implementing the goals and priorities, because they assess what is needed in the community during a pandemic and then do the work. So that is proof that they're really good at that part. And then others said planning and communication, outreach, just trying to involve as many people from different areas of the county as possible. In terms of areas where they felt that they could use more development, A couple brought up the resources and funding for the long term to sustain the council. They said this project and others are a good start, but they just kind of were interested to know how they could build capacity for their own health council. Mostly another comment was because when you don't have sustainable, it comes and goes, and then the membership of the health council comes and goes. It loses the active membership and you just kind of have to start over again. And so that's kind of where that was going. Also, someone mentioned organizing capacity. Just needing to be connected to the community seems to be maybe an issue with the larger and more established health councils possibly. And then also just some need for development in planning and just organizational structural capacity, basically, just needing the staff to do the work. And then in some areas of the state, equity is in an area where they could use a little bit more development. And then we went ahead and skipped to the last question because we were short on time. So what many hope to learn from this assessment is just kind of just sort of naming what they're good at and then finding out what the need is and then validating that. So like being able to show something to their health council members, look, this is where we're good and this is where we need help. And it's just going to really, that's what they're hoping to get from that. Someone else said they just want to know more about the planning about HB 137. The comment was made that, a lot of us forget about that. I know sometimes I do, it just doesn't cross my mind, but we really need to understand what the foundation is there. So also another comment was not only about HB 147 or 137, but where's the funding for that mandate? That was another thing that they hope to learn from that. And I don't know if that's taking up too much time, but I have a few more, but I think, are we running short on time, Ann?
We are.
Okay.
But you cover a lot of ground, Susie. Thank you so much. Number 8.
Hi, Ann. That was my group. This is Jamie.
Thank you.
So, yes, thank you. There was a lot of stakeholder engagement strengths. So most of the health councils felt like that was a big strength for them, particularly because they started implementing 100% communities within their community. So that really helped. There were also strengths in planning and working with community organizations, organization systems and processes. The health councils have been around for quite a while, so they've got a pretty good grasp on that. However, they feel like they need a more updated and equitable version of those not so glamorous parts of the work. And then in terms of building capacity, just knowing who to ask in the community for more support and how to address non-participation. So one of the councils actually recently sent out an email to their past members, current and past members, to see if they were still working within their organizations, if they had capacity to still participate, and just kind of doing those touch points to get people more involved. Another council said that they're really good at gathering the community, but they're not so good about pushing community policy changes or policy makers to make changes. And then we also heard about asking the people in the community, where do they feel like the inequities lie? So that could be a really important place to start, especially considering if you're trying to get buy-in and get the community to help out with the vaccine equity initiative. You want to have their voices heard. In terms of the self-assessment, people are excited to do the self-assessment. There was a little bit of anxiety around how many people to include, who those people should be, who knows enough about what's going on to provide valuable feedback. There was also a little bit of concern because mid-January is approaching pretty quickly, and they're still trying to encourage and share knowledge on what they're trying to do with the vaccine equity program. And there's also, they're sending out a survey to the same 10 people that they always send it to. It feels a little bit redundant. They think people are zoomed out, surveyed out, things like that. There was a concern about the timeline overlapping the vaccine equity plan implementation. I think I covered everything. Feel free to chime in if I missed anything important, Group 8. We didn't get to the last question. Oh, we did. We got one on the self-assessment. They want to see if we have consensus across members as to our strengths, needs, and goals. So somebody
Super.
did get one on there before we got brought back.
That's terrific. And Jamie, actually, I'm so glad you were group number 8 because it's a perfect bridge to our wrap up. So what we're going to be doing is we're going to be sending you a summary of these small group discussions, as well as a fact sheet that's going to just describe the process in some detail. And given all the conversations that I've heard and overheard, I believe that you all will, in your own health council, have the answers to who you need to invite, because you know you're the ones who really know your community, and we'll be sending information in that fact sheet about what you may want to think about, because if you're looking at and wanting to get at least 5 to 7 people, you know, providing information, that really gives a bit of a roundness to it. You may want to invite 8 to 10 or 12, and you may have 75 or 80 or 90% participation. And you'll want to invite people that know the health council. And one of the health councils in one of the small groups said, I'm going to go through the mailing list and take a look at who's been active. And you want those people to really represent a nice diversity, so that you have as much diversity as possible. And if you have questions or concerns, please contact Susie, Geraldine. We want to give you all the support that we possibly can. And what we want to do is to give you at least 3 weeks to complete this, so that people have some time and they're not going to feel pressured, because we know that there are the vaccine equity plans. So we want to give you plenty of breathing room around this. And we're going to be taking a look at what the responses are like. We'll have a deadline. And then if we don't have 5 to 7 from a particular health council, we'll contact you just to see what we can do to help you out. And then what we'll be doing is at the end of February, early March, we'll be sending you these summaries and then moving forward. I'm wondering, Susan, if you had any other comments you wanted to add to that process.
I think the other thing is we will be tracking, because it's on SurveyMonkey and it's electronic. We will be tracking. So if we're not seeing any results after 3 weeks, Susie will, or Geraldine may be reaching out to you. But if you have several people who are filling out the survey, what you'll receive in your summary is like, if you'll be able to see, was there strong consensus around how people scored that particular indicator? Or did you have like a variety of answers, everything from not developed at all to fully developed, depending on people's perceptions? So you'll get that type of feedback as well. So we will certainly be in touch throughout January, and then definitely reaching out if we don't see anybody who has completed it, say by the end of the month, early February, we'll be reaching out to those folks as well.
Yep. Thank you so much for a very rich discussion. And I'm wondering, Geraldine, if you would take us home.
Yes, thank you for today. I think the discussion around Health Council capacity definitely is on the right foot with the new year. So I think with the new year signifies a time for change, reflection, and visualization. So, you know, with our assessments coming up and working on those collectively, I think we should think of it as a collective approach to reassess, plan, engage, gather, you know, new insight, feedback, and do a collective approach in how you implement that. So, you know, with all the domains that you mentioned earlier, Anne, I just want to say this is a good time with the new year to celebrate all of the outcomes and impacts that have been achieved over the year, reevaluating our goals and priorities, reimagining our stakeholder engagement and our partnerships that are existing now and the new ones to come, and looking at new resources and funding. And then also reinventing our planning process and how we communicate with our stakeholders in our communities. And also lastly, restoring equity in everything that we do. So I just want to take this time to say thank you to all of our county and tribal health councils for your community efforts in supporting the health and welfare of all your communities. So we are definitely looking forward to the future successes of our county and tribal health councils for the year of 2022. So thank you so much and have a wonderful day.
And before everyone leaves, if you weren't reading chat, just a reminder that the Monday, the January 17th training is canceled in observance of Martin Luther King Day. And everyone should have received a notice about a special training in partnership with the New Mexico Alliance of School-Based Healthcare is happening on the 13th. And it's about how health councils can work with schools around vaccine equity.
Thank you so much.